So I'm here now with Dr. Sérgio Jacobovitz, a cataract surgeon from Brazil. So thanks very much for joining us.
It's an honor to be on Cake Magazine. It's a pleasure.
Well, you mentioned cake, and it's interesting because we've been talking about the trends in anterior segment surgery. And of course, being the purveyors of Pie and Cake magazine, we believe that there are trends that exist in our field, also related to cooking.
Yeah.
You know, and we're very interested to interview you because you have this Jacobovitz Multifunctional Chopper,
Yes.
a pre-chopper, which you've used to cut through chocolate. Very interesting. Tell me a little bit about why you decided to do that.
I was trying to find some substance that simulates hard cataract. So I choose it's not a good quality chocolate because I intend it to be very hard.
Not a Lindt chocolate, anything like that.
It's very with lots of sugar.
Yeah.
But it's very good for cutting and to demonstrate how does the chopper works in this substance. So I compare both traditional chopper, the conventional one, with the Jacobovitz Multifunctional Chopper.
That's fascinating. And just to pause for a moment, you know, the reason why we're talking about this also is Geuder has this cookbook that they've published called You Eat With Your Eyes First, or in German, Das Auge isst mit. So, I've contributed a recipe here myself from Cake and Pie magazine. But again, it's fascinating related to this pre-chopper because there's clinical value in explaining why this chopper cuts through chocolate. And one of the things that we've learned is that you kind of pre-chop by pushing forward, and it creates a straight line rather than sort of a pulling motion that creates a bit of a jagged line.
Yeah.
Tell me about why that's helpful in pre-chopping.
First, I think this chopper is very different from others. It has many characteristics. The first one, I think that's the most striking or the most important characteristic, is that this chopper this cutting action is forward, instead of the backward action of other choppers. Secondly, this is a multifunctional chopper. There at least three functions: cutting, retracting for capsule edge or iris edge, and also there is a platform, a flat platform in the middle that it's used to divide it. You mentioned a pre-chop. It may be used as a pre-chop or a pre-slice with bimanual technique.
We like that, pre-slice.
Pre-slice is with a set of two choppers, bimanual maneuver, but we can use just one instrument along with the phaco probe in the bottom step. So the second important characteristic is that it's more versatile. So at least three functions, and I developed myself three techniques for each hardness of movement.
Okay. Interesting. Well, you know, and off camera, I was asking you a little bit about the reason for this straight line chopping versus jagged edge chopping. And you know, in my mind, I was thinking, okay, well, femtosecond lasers, there's a reason for precision. But is it necessary to have such precision in a cataract that you're already going to be taking out? But there is a good reason, and explain that.
As we are talking about food, I will give you a comparison. If I'm a chef, a good cooker, I would like to have a very nice knife instead of a blunt one.
Yeah.
If I have a potato, it's safer and more precise if I have some knife that cuts very straight, very in a predictable way. Otherwise, the potato can move, and it may be even dangerous. Cutting my finger or not cutting what I intend to. So, for inside the eye, this is not just because I want that thing to be straight and beautiful.
Right.
Well, there are safety reasons. And sometimes when we try to chop a nucleus, especially the harder ones, with a conventional chopper, the nucleus rotates or spins in an improper mode.
Yeah.
and it may pose some risk to the corneal endothelium. So I think if the nucleus stays steady while I'm cutting it, and the cuts are more precise and more predictable, it returns into better surgical outcomes.
Yeah, it makes a lot of sense. And you talk about chefs. Of course, they want to have a nice sharp knife, but they're only in danger of cutting themselves. Here, we're talking about patients, right? So you're not only worried about your own precision for your own comfort, but also for the patient as well. Yeah, excellent point. Also, you're using a bimanual technique sometimes with two choppers. Explain why you do that.
This is first I started working with just one chopper.
Yeah.
I think it's the natural way you proceed. But this bimanual maneuver, it's very precise. There's a benefit of cutting with two instruments. It's go faster, and there is a neutralization of vectorial forces as I'm close to 180 degrees apart. These incisions are posed in a different mode from traditional. It's close to 180 degrees.
Okay.
You have to change this, but it's very easy indeed to go with this because the nucleus stays very steady. It doesn't rotate, and it's really, really effective.
Yeah.
And I invite you to see in the videos on YouTube.
Check it out.
Check it out.
Just search your name, right, on YouTube, Sérgio Jacobovitz, and they can find the videos. Perfect. Another thing that I liked about this pre-chopper was that essentially it sounded like you start from one end of the chamber and you push forward to the other. But oftentimes with pre-choppers you have to go, as you insert, you have to go all the way to the other end of the chamber and then pull forward, and it's wasted movement.
Precisely,
right?
Yeah. Is that imagine that we have a shallow anterior chamber.
Yeah.
We have a piece of nucleus inside in the middle, and we intend to cut it into smaller fragments.
Yeah.
If I have a conventional chopper, first we have to go or to pass over this fragment before returning to cut it. There's two movements, and as I go over this fragment, the instrument tips goes very close to corneal endothelium. But if I go forward in a straight motion, I go farther enough from corneal endothelium in a safer position. So shallow anterior chamber, it's less problematic. It's not like a nightmare.
Yeah. Okay. Well, also, we've heard from Geuder that the reason for this really is efficacy, safety, and versatility.
Yeah.
So can you speak to those points? Why this really speaks to those points?
Sure. First of all, effectiveness. The instrument is multifunctional. Its cutting edge is really, really sharp, like a knife, a very sharp knife, cooking knife.
Okay.
Second point is that this instrument has less than half of the thickness of other instruments. It's very thin.
Right.
And it's larger. So it's very easily, if you have a grade 4 or even a grade 5 cataracts, we go like cutting cheese or a butter.
I was going to say there's an expression in English, cutting like a hot knife through butter.
Yeah.
So maybe that could be the next test.
Yeah.
That'd be cool.
So the second about efficacy of this instrument, it has also the tracking area. It's a platform, and it's useful for the harder nuclei, but also, and more importantly, for the softer one. Like gelatin, sometimes when we want to take a piece out of gelatin, as we talk about food.
Oh yeah.
With a conventional chopper, this is not so easy to take this piece out of the gelatin.
Okay.
But if I have a platform, like in the new chopper, it's really easy to divide very soft nucleus. So it covers a wide range of cataracts, from the softest to those most challenging cases, hard cataracts, white cataracts.
And you know, at the end of the day, we're talking about improved patient outcomes. So would you say that indeed this does help to lead to those improved outcomes?
100%. I have the testimony of other colleagues. It was like my observations that it may reduce the cumulative dissipated energy in about 50%.
Very good.
Also about, you were asking about safety
Yes.
and effectiveness. So safety, as it cuts with a forward movement, I go farther from motility. I work almost always very close to the center, in the middle, under my perfect vision of instrument tips. I don't need to go through the periphery before returning to cut. And for shallow anterior chamber, as I mentioned before, and about versatility, I may use it as a one-hand technique, bimanual technique, horizontal technique, vertical technique, and it cuts, retract, and splits, three in one.
I'm also curious as to why. Why does it cut so straight compared to conventional choppers?
What is thinner, half in thickness is the main reason. It's really sharp.
Yeah.
Geuder make it
Nice
possible.
and sharp. Yeah.
It's not easy because it dimensions. It's about 1.2 millimeters high.
Okay.
The same of conventional choppers.
Yeah.
It's wider, it's deep, and much thinner.
And may I ask, what grade cataracts would this chopper be used with?
I've been using this chopper for the last 5 years. Me and my colleagues, we have about 1,600 cases of cataracts. And I may say that 99.9% of the cataracts are okay. From grade 1 to grade 5, it's very
excellent.
It's okay.
Very versatile.
It's maybe in a very few cases difficult for all techniques. We may find some difficulty, but with patients and skilled hands, we can manage with this job.
Excellent. Well, I once again want to thank Geuder for this incredibly interesting topic that we've discussed today. Thank you for providing this Jacobovitz Multifunctional Chopper. And meanwhile, also I'd recommend this Geuder cookbook once more. You eat with your eyes first. I myself have a recipe for banana bread. As everyone knows, I like banana suits that I've been wearing a couple years now. So thanks so much for joining us at Pie and Cake Magazines. We'll see you maybe in Brazil next year.
Yeah, you are welcome.
Thank you. Thank you so much.
You are very welcome.
Thank you, Sergio.